Welcome back to the continuing evolution and history of RxP. Today we present part 2 of my conversation with Dr. Maria Marquez. In our last episode, Dr. Marquez took us through the history of New Mexico's pioneering role in the prescriptive authority movement and the journey that led psychologists to begin prescribing in 2005. Now we turned to what happened next, his early experiences as a prescribing psychologist, the challenges he faced, and the lessons learned that continue to shape our field today. What was the most unexpected, from your point of view, aspect of doing this work once you actually started prescribing?
Oh, that's an interesting question. Well, George, it was full disclosure, that 9 months of investigation. Because see, I had the license and the investigation started almost more or less around the same time. So I got licensed, but then I got this uh, complaint filed. So for the first 9 months, I was very, very careful, obviously.
Everything was under scrutiny.
So I kind of just tried to defend myself against the complaint, and I wasn't doing a lot clinically in terms of prescribing. Although I did, I think uh, with parents' permission, take some children off of some of the meds, one at a time. Because you know how to withdraw medicine, it takes time. And you do it very, very slowly, very, very carefully, just a little bit at a time. Throughout that time, I had the same attitude. I wasn't interested in giving children drugs, George. I really wasn't. They didn't work. They don't work for the most part. Maybe a little bit here and there, but generally speaking, look at the studies, look at the results, look at the effect studies. Uh, you get very little benefit.
Very little additional benefit with getting more medications. Yeah.
Yes, except for for the ADHD drugs. I'll give you that. They were more effective if for ADHD. But a lot of these other and these are nature tranquilizers that they give out. Heavy duty drugs, and with all these interactions and with all these side effects and all these toxic effects and all these black box warnings, I still was more interested in taking children off of the medicines than prescribing them, unless it was an ADHD type situation. An ADHD type situation. Let's try this one benign medicine, if you can call it that. 'Cause as far as giving medicine for sleep, for depression, for anxiety, for acting out, for waking up, these cocktails were clearly, in my mind, inappropriate. I would rather work with the child, George. I'd rather talk to the child. I'd rather support the child. I'd rather nurture the child. Talk to the family. Talk to the parents. Give them some parenting skills. Give them better options than drugs.
And that cycles back to, one of the themes that I think permeates our conversation today, which is, as psychologists, we have so many other tools that we can utilize. And that's one reason why we are usually more conservative with regard to both the dosages as well as the amount of medications we prescribe, because we don't have to rely on our prescription pad to fix all the problems that we encounter, right? The old saying is, when the only tool you have is a hammer, every problem looks like a nail.
Yes.
Well, we have so many tools that we can, utilize other interventions.
Yes. Yes.
Is that what you think our one of our strengths is as prescribing psychologists is that we can intervene so comprehensively?
Yes, that's definitely one of them. And I raised some eyebrows when I would speak to groups and legislators about this, and even my own colleagues would raise their eyebrows when I would say psychologists can do it better. Psychologists can do it better. I remember saying that, and it's coming to fruition. Psychologists are doing it better, George. Like you mentioned the factors. We're more conservative. We don't rush to medication. We don't see a patient for 15 minutes and give them 2 or 3 drugs. That's not the way we operate. And so in my opinion, we're doing it better. We don't do 10-minute med checks, George.
And a lot of the data really supports that. Some of the data that's been published by some of the research done by the prescribing psychologists and their students and their research teams shows that we are far more likely to include psychotherapy together with medication management, that our sessions are longer than they are for psychiatrists, that we're more likely to practice with underserved areas and accept Medicaid than psychiatrists, which is I wonder if that's been your experience in New Mexico as well.
Yes, there's many factors, George. We're touching on some, we're touching on many of the factors here as we speak. Another factor, George, is when a psychiatrist has a differential diagnosis issue, who does the psychiatrist call to help with that differential diagnosis? A psychologist. We're much more adept at diagnosing than psychiatrists, in my opinion. We're much more adept at treating mental health issues than psychiatrists, in my opinion. The medical model works well for a lot of ailments, a lot of diseases. Thank God we have doctors. But in terms of emotional problems, mental health problems, George, we can't even explain what causes depression. We don't know completely how the brain works. There's so many things that we don't know about in terms of mental health, the brain, because this is where those drugs are affecting. They're affecting neurotransmitters and brain cells, all the other aspects of the psychopharmacology part that we don't know. So even the trainers will tell you, George, it's more of an art than it is a science. And that's not the case for most medical practice. Most medical practice, it's scientific, a lot of it, but psychiatry is not. And I've heard psychiatrists, those who trained me, told me that yeah, there's science involved. Of course, there's science involved, but when you start practicing, it becomes more of an art because there's so much trial and error. There's so much trial and error. And now when you start mixing drugs, when you start doing the polypharmacy, you can't be sure what the effects exactly are. Are they therapeutic effects? Are they interactions with other medicines? Are they side effects? Are they a combination of the three? It's hard to tell. And the only way you can tell is by adjusting doses and switching meds. And so people spend their whole lives with their meds being adjusted and their medications being switched. Now, when you come to a perfect treatment, that's great. But sometimes it takes a lot to get there.
Absolutely, and that's especially true when I'm listening to you describe some of that. I'm thinking about how particularly relevant that is to practice with the pediatric population, right? Where we have less trials and hard evidence for drug efficacy in the first place. where we have much more differential response, both in terms of beneficial effects as well as adverse effects, right? Medications in general tend to be more unpredictable in terms of the expected effects in the pediatric population. So a lot of what you were just saying really resonates with me, but how closely it applies to specifically pediatric psychopharmacology.
Yes, it makes it more complicated. So medicine should be used even less so with children, and not more so.
I'm curious from your point of view, both as a practitioner and also as an observer of how everything has evolved in New Mexico. How do you think our practice has grown and evolved in the state since you guys started first prescribing? I think it was in February 2005. So it's been a while. How do you think it has evolved over the years?
I think it's wonderfully evolved. I really am so proud of you, George, and all the other psychologists that have come on board and have made the practice even better. And you really built up something that New Mexico prescribing psychologists can be proud of. And as you know, I'm retired, but I keep up with the news, with SPA and with APA and with Division 55, and so I'm aware of what's going on. But let me say this, George: New Mexico is doing it better than any other state in the United States. And I don't mean to raise people's eyebrows with that, because way back in 2000, when I would make these brash statements that psychologists can do this, you know, I mean it from my heart. I don't think any other states are doing it as well as New Mexico. We have the best rules, we have the best regulations, we have the best uh, certification process. I know the other states they're new, they're starting off, and I think they will evolve to where New Mexico is now. But right now, New Mexico is the preeminent state for prescribing psychologists, in my opinion.
And that leads me to a question I really wanted to kind of get your opinion on, and that is, um, you've been following the developments with RxP in other states, right?
Yeah,
And in at least some of those states that have passed RxP, significant compromises had to be made, right? In Illinois, there's all kinds of restrictions on the types of medications we can prescribe, on age groups. Um, in Colorado, you actually have to have physician's permission and approval to actually write the prescription. In Utah, although I don't think anyone's practicing there yet under this particular law, but so far we're limited to actually writing prescriptions for SSRI type antidepressants. So, what do you think about the idea of other states passing RxP with so many restrictions?
you know, it has to be done. It had to be done in each of those individual states, and the psychologists that push this through uh, have no choice, from my experience, because that's how we started off in New Mexico. We started off with restrictions. We started off with formulary problems. We started off with liability problems. We started off with supervision problems. We started off with many, many problems because although we tried to write a very solid statute, there's always things that when you go back, you didn't put in there correctly, or you forgot about, or what have you. There's just a lot of details in this stuff. And then when by the time the rules and regulations are written, they actually put more restrictions on there. But if 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 the psychologists are benefiting the patients and the population, I think you can win over the legislatures and the governmental agencies to allowing less restriction. And this is my point now. in terms of what I'm saying about New Mexico. See, New Mexico's evolved. It's a much, much different law today in 2025 than it was in 2002. It's much different. It's much better. It's much more evolved. It's much more effective. It's less restrictive. It allows for more uh, and better treatment. But I understand why these states have to make compromise with these restrictions. I really do. But if they continue, they can go back to the legislature and fix those problems, which is what we've had to go back at least, what, 5 or 6 times? I mean, the first year we had to go back, George. The very first year we passed the bill, the next year we had to go back because there was problems. And then we had to fight like the Dickens to get those rules and regulations uh, in place without all these restrictions. They were putting so many restrictions in there that nobody could have prescribed. No one would have ever prescribed. But thankfully, we had the legislatures and the governor at the time. The governor backed us up, and he said, "No, we're doing this," because they were stalling. It took us 3 years or so. Well, you said 2005 when we started prescribing, when we actually got our licenses. We passed the bill in 2002.
Two.
It was 3 years before we got rules. It was a worse nightmare than the bill itself.
Is that your advice, sort of, for states that are in the trenches now trying to pass RxP? Is that your advice, essentially, to pass whatever you can?
Yes, and go back and fix the problems because otherwise you'll never pass it. You have to make compromises. Uh, and that's how the legislature works, right? It's all about compromises. It's all about relationships. So my advice is develop solid relationships with legislators in your state and win them over. Psychologists, we're trained experts in getting along with people, aren't we, George? Isn't that what we're supposed to do? Get along with people? We're much better than the psychiatrists. That I guarantee you, because I see the psychiatrists in action. I saw the psychiatrists in action, and they don't even come close to being kind and warm-hearted and uh, uh, gentle with their patients. Doctors are known for that, and especially psychiatrists. They're trained in having this distance with their patients. Psychologists tend to be more compassionate and sympathetic, in my opinion. And so when you develop these relationships with legislators, you win them over. I used to go to dinner with Ed Sandoval, and we'd go out to eat, and Matty Alagon, the Senate President pro tem. We went to lunch, and we went over to his house, and we visited, and we became friends, in other words. Became friends. And this is how you got to get it done, because it's politics. This is not about psychology. This is about politics.
And it's such a great point that you've mentioned that, again, resonates with me, that, as psychologists, we're trained to develop this therapeutic alliance. If
Yes,
we can utilize some of the same training to now build some of these alliances with the legislators that we need for their support,
that's it.
that certainly is something that, within the context of a therapeutic relationship, we all do that so well. We have to have the ability to utilize the same set of skills to build these alliances with the legislators.
George, you say it so much better than I do. Yes.
What advice would you have to anyone contemplating moving to New Mexico to become a prescribing psychologist?
Do it. Absolutely. We'd welcome you here. We love our prescribing psychologists here. We don't have the kind of shortage that of prescribers anymore, because, as you know, since we've been on the move, our movement, other professions have been on movement also, like the nurse practitioners. They can prescribe psychotropics now. Pharmacists, clinical pharmacists, all these doctoral level professionals. So we're not as strapped as we were, but you'll love New Mexico. Uh, it's a beautiful state, and it's an upcoming state, and we're making progress in the areas of mental health, and we have the best prescribing psychology program or department or whatever you want to call it in the country. We're number one, George. And New Mexico can't say that for a lot of things. Usually New Mexico is 50th. Like, we're 50th in terms of our uh, ranking among other states. We're one of the poorest, you know, but in terms of prescribing psychologists, we're numero uno. We're the best. So yeah, please come on over.
Any final thoughts for our viewers?
George, I wanted to thank you for inviting me on and letting me share a little bit. I've been out of touch for a while because I've been retired now for a few years, and it was it's been 20 years. It's hard to believe, but I'll never forget that experience, and it was well worthwhile. And I just think that a lot of people have been helped by prescribing psychologists. And now the State Psychologists Association of New Mexico, under your leadership and others that have come before you, have just made the practice much better by going back to the legislature and fixing problems and opening up more and better treatment. It's a great thing. It's a great thing, and I love the movement. I love the movement. My heart is always be with those that are work so hard. And as you know, there's plenty of people around the country and in states. It just happened to be that we were the first, and we took a punch, we took a hit from psychiatry, but we learned a lot, and we shared everything with the other states. And to this day, we share all of our materials, all of our data, all of our experiences, and people in other states have taken advantage of it. So my thoughts are just gratitude. I'm grateful to you for letting me share my thoughts, and I get wound up a little bit. I get excited because it was such a great thing, and it was so successful, and it's continuing to be successful and even more successful than it ever was. And so I'm very happy. I'm very blessed, very, very grateful.
We are very grateful for you, Dr. Marquez, for everything you've done for the profession of prescribing psychology as the pioneer of it that you have been, for everything you've done for us here in New Mexico, helping lead the way for future generations of prescribing psychologists. And thank you once again for joining me for a most interesting and stimulating conversation, reviewing some of the history that I hope will help inform other states as they are continuing to organize their RxP movements. And thank you, everybody, for tuning in. And we'll see you at another episode of our Psychopharmacology podcast series at Alliant International University. Have a good day.